Before performing a flexibility test, you want to warm up for about 5 to 10 minutes. You can do about 5 minutes of jogging just to get your body warmed up, and then another 5 minutes of a couple of dynamic stretches. For the Canadian trunk forward flexion test, you remove your shoes and place the soles of your feet flat against the flexor meter or the sit and reach box at the 26 centimeter mark. The inner edges of your soles are placed within 2 centimeters of the measuring scale. Then you're slowly going to reach forward with both hands as far as possible, holding this position approximately 2 seconds. Be sure to keep your hands parallel and that one hand does not lead the other. Your fingertips can be overlapped and should be in contact with the measuring portion of the sit and reach box. The score is the most distance point in centimeters or inches reached with the fingertips. The best of 2 trials should be recorded. To assist with the best attempt, you should exhale and drop the head between the arms when reaching, and otherwise breathe normally, never holding your breath. Ensure that your knees always stay extended, but do not press them down.
The YMCA sit and reach. When performing the sit and reach test, remove the shoes, place yardstick on the floor, place strip of tape on a 15-inch mark, place the feet on tape edge 10 to 12 inches apart. Reach forward, exhale as you're reaching. Fingers must touch the yardstick. Hold for 2 seconds. Do not lead with one hand. Ensure knees are not bent. Score should be in inches. Repeat the assessment. Take the best of 2 scores.
The chair sit and reach test is a measure of the ability to perform ADLs such as climbing stairs and getting in and out of a car, chair, or bathtub. You will begin by placing the chair against the wall for stability, and you will sit on the front edge of the seat. You will then extend the leg being tested in front of the hip with the heel on the floor and the ankle dorsiflexed approximately 90 degrees. Then, you will flex the untested leg so that the sole of the foot is flat on the floor about 6 to 12 inches to the side of the body's midline. With the extended leg as straight as possible and the hands on top of each other, palms down, you will slowly bend forward at the hip joint, keeping the spine as straight as possible and the head in normal alignment with the spine. You will reach down the extended leg, trying to touch the toes, and you will hold the position for 2 seconds. For scoring, the middle of the big toe medial aspect at the end of the shoe represents a 0 score. Reaches short of the toes are recorded as minus scores. Reaches beyond the toes are recorded as plus scores. You will record the best score to the nearest half inch. The Thompson Test accesses the flexibility of the hip flexors. These muscles tilt the pelvis anteriorly. An imbalance between these muscles and the hip extensors can negatively affect the functioning of the lower back. Begin by lying in the supine position. Then bring one leg, the contralateral leg or the leg that is not being tested, in the direction of the chest, just to the point where the lumbar spine is snug to the floor or table. If the tested leg remains in contact with the floor or table during this maneuver, the hip flexors of that leg are adequately flexible. If the tested leg rises, its hip flexors are likely to be inflexible or short. Once you are completed, record whether the hip flexors in the right and the left legs are flexible or inflexible.